Welcome to the Intimate Wellness webinar. Tonight we're going to have a deep dive into what's going on inside of our bodies and how we can help to heal your body and mind. I'm Phil McClure. I'm a family nurse practitioner. I have been in medicine since 2004 as an NP since 2015. We opened our doors here at Alternative Aging and MediSpa in February of 2022. Tonight, I'm hosting with my husband, Alma McClure, and we have guest speakers Kirsten Klein with BioT and Leslie Brooks with BTL Aesthetics. On the right, you'll see our agenda. This is just an outline of what we'll be going over tonight. Our goal tonight is understanding the importance of sexual health and how it affects our overall health. Physical intimacy is the foundation of human relationships, from the protective embrace of our mothers, to the tentative touches of young love, to the deep connections we foster with our partners. Physical intimacy connects us to those we love. Unfortunately, as we age, there are many variables that affect our ability to maintain and enjoy physical relationships. Although sex isn't the defining factor of a successful relationship, lack of physical intimacy in the form of sex can lead to feelings of isolation, abandonment, broken communication, infidelity, and lower self-esteem, which can all impact mental health and the relationship as a whole. A void is created because of the lack of the primal need, physical connection. Today, we are going to review several factors that may be impacting your physical relationships, and then discuss how we can help you to correct or improve those issues at the most fundamental levels. And our first presenter is Kirsten Klein with BioT.
So I love that little video right there, Phil and Desi. That's awesome. Like Phil said, my name is Kirsten, and I'm the local rep in the area for BioT. First, I want to say thank you for having me join tonight. I've had the pleasure of working with Phil Allen and Desi for about a year now, and they are just wonderful and amazing, and I think will take such good care of you. So tonight I'm going to talk really briefly about hormones and just how having the right levels of hormones in your body will help improve the quality of your life. So first off, what are hormones? So hormones are chemical messengers that are made by the endocrine glands that control certain actions of cells and organs. They work as a lock and key fashion. So I like to think of it as I have two keys on my keychain. One is bronze, one is silver. One goes to my mother's house, the other goes to my house. And if I put the silver one in my own door late at night, it will fit in, but it will not actually turn the lock. That's how hormones work. There are certain receptors in the body that only accept those certain hormones to make those glands and cells and organs work. So really the question is, do we age because we're losing our hormones, or are we losing our hormones because we're aging? Next slide, please. So do you feel like this? Run down, tired, depressed, anxious, or do you feel like this? Outgoing, happy, energetic, in love. Next slide. So there are a ton of different symptoms that can be associated with hormone imbalance. Things like, and I'm not going to go through all these, but you can read them. So things like, do you ever walk into the kitchen and forget what you walked into the kitchen for? Do you have a hard time sleeping? Do you wake up in the middle of the night and have a hard time going back to sleep? Do you lack focus? Do you have joint pain? I actually spoke with a doctor in the Richmond area today who his biggest side effect that he is feeling is his joints don't feel as creaky when he reaches down to the floor to pick something up. Do you have fatigue during the day? My biggest problem was that I would need to take a nap in my car at 2 o'clock in the afternoon, which as a sales rep, that's problematic. So those are all signs of possible hormone imbalance. So at BioT, we actually focus on 3 different hormones. Tonight, we're just going to focus on 2, our main hormones, but we focus on testosterone, estrogen, as well as thyroid. And then we also have a line of clinical grade nutraceuticals that support hormone optimization. So we're going to just dive a little bit into menopause and andropause. I know we all know what menopause is, but maybe not what andropause is. So here's just a few fun facts about 6,000 women enter menopause daily. The average age of someone entering menopause or becoming menopausal, quote unquote, is about 51 years of age. but patients actually start to experience symptoms of menopause about 15 years before, so in their late 30s, which is a little scary. And most of us don't even realize that those are symptoms of hormone imbalance or hormone decline. And you never really get through or over menopause. It is a phase of life because your hormones are depleted and you're not going to ever make more. So all you can do is replace them. I always find this pretty staggering personally. So 1 in 7 premenopausal women will die of heart disease, but 1 in 3 postmenopausal women will die of heart disease. So what is the difference between those premenopausal and postmenopausal women? Well, the one main difference, and there's probably more, but the one main difference is the fact that they no longer have hormones. So they're lacking testosterone and they're lacking estradiol. So andropause, most people have heard about menopause, but they haven't heard of andropause. So andropause is actually male menopause, so menopause. 38% of men over the age of 45 have low testosterone. Many of them do not know it. It's common in men who have sleep apnea, diabetes, other chronic diseases. It's actually linked to early heart disease. And very often it's undiagnosed. Just like females, they think it's just the way life is as we get older. Men think the same thing as they're getting older. Their feelings that change and develop and their tiredness and other things that happen, they think that's just normal. So, testosterone. So, some fun facts about testosterone. Testosterone is present in both men and women. Before I came to BioT, I really had never thought about the fact that females have testosterone, but actually females have 4 times more testosterone in their body than they do estradiol. Of course, men have a lot of testosterone and women have smaller amounts. Men will lose 1 to 3% per year between the ages of 30 and 70, and women will lose up to 50% of the testosterone that they have by the age of 40. And so testosterone is going to be a major driver in helping with symptoms on our symptom questionnaire, things like that: fatigue, better sleep, mental clarity, libido. But there's also a lot of protective aspects of having your testosterone levels at the right level. It's protective of the bone, the brain, the breast, the heart, and relationships. And before you move on real quick, I kind of just want to hit on 2 of those. Testosterone is a huge benefit to your bones. There was actually a study that was published that showed that patients who were on testosterone pellets, so the delivery method matters, had an 8.3% bone regrowth. So that means it's a bone builder. So it can help, we've seen it help to reverse osteopenia and help really just kind of build bone back. And then the other thing I know everybody has some misconceptions around is breast cancer. So testosterone and estradiol are actually both breast protective. There was a study that was actually published 3 years ago. There's a lot of studies, but there was a study 3 years ago that was published in the European Journal of Breast Health that actually looked at patients, 2,300 patients who had been pelleted with testosterone or testosterone and estrogen. And it showed a 35% reduction in the incidence of breast cancer. And that was in premenopausal and postmenopausal women. So there's a lot of studies out there. There's a lot of misconception, but there's a lot of studies out there that actually show that testosterone and estradiol are breast protective. Next slide. So kind of just going back a little bit to testosterone. So here are some of the things that testosterone can help with. So more energy, better overall feeling of well-being, more mental clarity, more focus, actually can build more muscle mass, reduce cholesterol, and then again, all those protective aspects of it. So estrogen, so we don't give females or males estrogen, excuse me, but men do have estrogen. So both men and women have estrogen. Large amounts again in women, small amounts in men, and estrogen actually has over 400 functions in the body. So here are some of the things that estrogen can help with. So for females, estrogen is a big helper with the symptoms associated with menopause. So those hot flashes, those night sweats, that vaginal dryness. It actually helps to maintain skin collagen. It also helps to help lubricate or moisturize the skin. They're considered happy hormones, helps with bone density, and again, it protects the bone, breast, brain, and heart. So The delivery method that we're talking about tonight is bioidentical pellets. Pellets have been around for a really long time, since 1939. They are very, very, very widely studied. The first study that they used them for was actually in women who had menopausal symptoms. So there's a lot of information on pellet therapy out there. It's very well researched. So what are some of the benefits, or what are pellets? So pellets are bioidentical. So what that means is that they are the same molecular structure as what your body already has. There are other types of delivery methods out there that use synthetic, which actually have to be converted into what the body can use, but pellets are actually what the body already needs and can use. They're made from plants, so they're natural. They last patients on average. Your female patients, they're going to last for 3 to 4 months. And for your male patients, they're going to last 4 to 6 months. And what I really like is it provides a steady state of hormones in your bloodstream. So you're not going to have any peaks and valleys. It's just going to be a nice, steady delivery. It's individualized dosing. So what I receive and what, as you saw in that video, Desi receives are going to be different based on our lab levels and our medical history. And then it's implanted under the skin. So it's super simple and hassle-free. You put it in and you don't have to think about it for another 3 months. So what is the BioT method? The method that Phil uses in the practice. So again, it's that bioidentical. So it's that human identical form, individualized dosing, and then it's the subcutaneous pellet implant. And wrapping it up, here's some of the key takeaways. So hormone imbalance is going to happen to all of us at different times in our life as we're aging. Could happen in your late 30s, could be in your 40s, in your 50s. But it's going to happen to us all. There are so many options out there, so many opinions out there. So you have a great provider who is very knowledgeable, who can answer all those questions for you. It's not a one size fits all approach. So like I said, what it's good for me is not going to be great for my mom or something like that, but it's why there are options. I believe in pellets and the fact that you can individualize the dose of pellets for each patient. And then the last thing is, even though the labs say you're normal, normal is not optimal. And look at your symptoms and how are you feeling? Maybe having a little therapy added to your hormones will help you get to that place where you're not feeling the symptoms that you're feeling. So schedule some labs with Alan and come in and see Phil.
Thank you, Kirsten. Yes, it's been a great year. And yeah, guys, come and see us. Kirsten, you're fantastic. We appreciate everything that you've done for us. And next up, I'll be telling you all about the Alma Duo.
Let's talk about sexual well-being. Every man and woman deserves to have good sex, but so many don't. Every second man over 40 experiences some form of erectile dysfunction, and 60% of women are just not satisfied with their sex life. That's an enormous number of people that cannot reach that glorious state of sexual well-being. If only there was one solution that could help both men and women strengthen their relationships and bring joy and spontaneity back into their sex lives. Actually, there is. Introducing Alma Duo, a revolutionary, advanced, and effective solution for men and women. In a series of just 6 15-minute treatments, Alma Duo uses the gold standard shockwave technology to promote blood flow in the patient's genitals, making sexual intercourse feel stronger, more intense, more orgasmic for both men and women. The Alma Duo clinically validated technology restores the natural sexual function of the penis and can be effective for up to 2 years. No more blue pills, no needles, no surgery, no pain, no downtime. Alma Duo. Always a pleasure. Alma. For you, for life.
What is the Alma Duo? It's a treatment for men and women to improve blood flow to targeted areas, specifically an area that, well, we'll talk about it. And it brings back spontaneity to men's lives and increased sensations to women's lives by restoring natural performance. How does the Alma Duo work? Well, it's a focused, low intensity shockwave pulse that triggers an inflammatory response to the treatment area that targets vascular function. In short, it rebuilds veins and it generates new veins. The treatment protocols are 6 treatments spaced 2 to 3 days apart. It takes 10 to 15 minutes. There's absolutely no pain. There is a tapping sensation and a sound, but there is no downtime. So who's a good candidate? Men with vascular issues affecting their performance and women who have difficulty reaching orgasm. What do you want to expect during treatment, or what to expect during treatment? The patient lies on a treatment bed and a practitioner will place the applicator head onto the treatment area. It is 5 treatment areas for men and 3 treatment areas for women. Very simple. Let's talk about contraindications. The Alma Duo is not recommended for patients with, honestly, a tumor in the treatment area. Penile tumor, prostate tumor, testicular tumor. We can't treat you if you have an infection at the treatment area, or a blood clotting disorder, including thrombosis. If you've had a recent steroid injection, recent being within 6 weeks, if you have a pacemaker, or if you're under 18 years of age. And simply put, that's the Alma Duo. Coming up next, Leslie Brooks from BTL Aesthetics to tell us all about the Emsella Chair. But real quick, first, Phil, what's a pelvic floor?
The pelvic floor is a group of muscles that is bowl-shaped, and it supports our pelvic organs, such as the uterus, the bladder, the rectum. Everybody has one, men and women, although most men don't know that it exists until they sit on the Emsella. Most women can tell you where it is because we've been taught to do Kegels, although we don't do them nearly as much as we are taught to. And when we do them, they're not as effective as they are when the Emsella does them for us. So strengthening this area will give you better control over your bladder and bowels. It can help to improve sexual sensation and orgasmic potential. It strengthens literally the core of you. It's a supportive piece of your muscles. So it can help relieve back pain, hip pain. It can prevent prolapse by strengthening the muscles that support those organs. So how can we help you strengthen your pelvic floor?
So I'm here, hello everyone, to introduce the BTL Emsella Chair. We also have dubbed this the Kegel Throne. That is because this chair will do 11,000 Kegels with a 10-pound weight for you while you sit fully clothed. We use high-intensity focus electromagnetic technology. It's non-invasive, there's no pain, there's actually a tapping mechanism on it that will tap the lactic acid that's been broken down from the muscle into the lymph system. And then you're just going to hydrate and flush that out. So the next day, you cannot tell that your body did 11,000 Kegels. You sit fully clothed, and it addresses both urinary incontinence and then also intimate health for both males and females. So 27% increase in feminine procedures per year. So women are constantly seeking ways to help with incontinence issues. A lot of times people think that they have to live with incontinence. And now I think people are being educated, understanding that they don't actually have to anymore. So in the US alone, 19 million women suffer from incontinence, at least some form, whether it's leaking when they sneeze, panty liners, all the way to adult diapers. 200 million people worldwide suffer from incontinence. 45% of those incontinent women report the loss of intimacy and confidence. There is, a direct correlation to not being confident and being embarrassed, and then, not being able to hold your urine, so you kind of hide. Men, 11% of the male population suffers from urinary incontinence. 78% are not aware of non-invasive procedures. It's just not something that men typically like to talk about. So sometimes they just kind of hide from the conversation, so they don't know the things that can be done to help them. Urinary incontinence is associated with other intimate health issues, and that's for both sexes. The Emsella helps with different kinds of incontinence. So urge incontinence is when you all of a sudden have to go. For stress incontinence, you feel that when you sneeze and you leak a little bit, or a lot of moms say that when they're jumping on the trampoline with their child, they leak. People in the gym, if they're lifting weights or doing jumping jacks, a lot of times they will leak a little bit and it's time to run to the bathroom for them. So it does interrupt their day. And then there's mixed incontinence. So a little bit of both, and this will still help with that. We've got 10 published studies. We've got more on the way. Oh, that's cute. Get back to jumping up and down with joy. So the way that the Emsella works is it uses electromagnetic therapy to target the muscle. So the pelvic floor muscle is a very large muscle. It's very underused. We don't even know how to properly do Kegels. First, they said, when you're urinating, just stop the stream of urinating, clench really hard. That's a Kegel. But now they're saying don't do that because it can back up and give you a UTI. So this device actually will do 11,000 for you with a 10-pound weight in 28 minutes. And that protocol is twice a week for 3 weeks. So it's a total of 6 sessions. This will strengthen your muscle up to 10 centimeters deep. So again, we're targeting that large muscle. And when we say super maximal contractions, we're actually targeting 100% of the muscle fiber. So the workload is not spread out. It is a direct target to strengthen that core or the core muscles. So sexual dysfunction, Emsella can help with decreased sensation. It's actually pulling the blood flow down to that area for both men and women. And so it will help increase sensation. It makes things pretty sensitive down there by the time you have your last session. It will help with painful intercourse, pelvic floor pain and weakness. It will also help with ED. We do have studies coming out, but it will help with the orgasmic disorder in women as well. And this, again, is because we are improving that blood flow to the pelvic floor. So we see improved erections, increased sexual satisfaction from both men and women, and improved orgasmic function for both as well. And then you can see the studies here, a couple of just one-sheet studies that I pulled just to show the highlights of urinary incontinence and then helping with erectile dysfunction as well as sexual satisfaction in men. In women. So when you are doing this treatment, it is so easy. You can literally wear anything except Lululemon leggings because they now put copper in them. So it is a magnet, so it's electromagnetic therapy. So we don't want any metal. Jeans would be a little bit restricting. You do have to get creative with positioning, but you just sit up straight. You're gonna sit wider, like a wide knee sit. So a little bit wider than your mom would probably want you to sit. So knees are spread apart and you're targeting that middle area between the girl part opening and the anus or the boy part and the anus. That flat part right in the middle, also known as the perineum floor. Treatments, again, are twice a week for 3 weeks for a total of 6 sessions. You do want to check in with yourself about 6 months. Do a follow-up if you're starting to think that you might need a little maintenance session, you come back. Remember, it's a muscle. And so if you don't use it, you lose it. This is a hard muscle to use. And so you want to check in with yourself. We're building the muscle for you, but we do have to maintain it because we're aging every day. Contraindications. So metal implanted in the body, pregnancy and nursing, malignant tumor, fever, copper IUD. There are IUDs that are not copper. I think the Paragard is the only copper one right now on the market. Pacemakers, defibrillators, anything implanted, that's expensive technology. We are using a magnet. We don't want to turn anything off, especially if it's providing port for you, but also we don't want to mess up anything. Drug pumps, pulmonary insufficiency, any sort of application in the head or heart areas. That includes like a cochlear implant. If it can't be removed, again, it is more of a thing where that's very expensive technology, and we don't want our technology to inhibit the use of that. Thank you. You're welcome. Thanks for having me.
Thank you, Leslie. We love you. We'll see you soon. All right. So the questions that we're often asked are, how do they all work together? Or do I need to do one at a time? Or what order should I do them in? And the reality is that they're great individually, but they're meant to be accomplished together simultaneously. So it says our intimate wellness packages, but truly Phil curated these complementary technologies and these treatments to build intimate wellness plans that address anyone's needs and overall sexual wellness. I like to call it foundational wellness. So we found these treatments, they all work very well together to support the brain and the body functions, as well as addressing health and wellness in the individual as a whole. We're looking at any dysfunction at its source, repairing that damage at its source so that you can live without needing all these little band-aids. And again, it's the foundation of you. It's hormone optimization. Kirsten said it, normal's not optimal. We're increasing pelvic floor strength at the same time that we're increasing blood flow to the entire pelvic area. Any one of these treatments will improve intimate wellness, but together they can transform your life. They can help you rebuild your relationships, and they can make you feel like you deserve. Thank you to everyone who tuned in tonight. You see on the screen here are a couple of QR codes. One of them is going to take you to our website. You can check out all of our services there. The other one's going to take you to our app. You can check out many of our services there as well as you can make some purchases directly on the app if you're so inclined. Also, our app is a rewards app. So when you download it for the first time, you actually unlock your first reward. And I'd love to talk to you about that when you come in for a consultation about how to redeem that reward.
I know that was a lot of information, and I know it can be a little overwhelming to hear yourself in so much of it, or at least it was for me. The good news is we can help. At our office, we utilize all of these treatments individually and in combination to create a treatment plan that best suits your specific needs. The bottom line is intimacy is what makes life worth living. Stay connected.
Oh, I slept like I had not slept in over a decade. Doesn't sound like much, maybe. But when they talk about, you're going to sleep better, you're going to feel better, you're going to feel more rested, you're going to have more energy. I really feel like the first step in that is putting your head on a pillow at night and sleeping soundly through the night and waking up the next morning feeling better than you did, the morning prior. And it's just a cumulative effect. And it's been almost a year now. And it just compounds over time. You feel better. You've got more energy. You feel more capable. You do more. And it just snowballs from there.
I'll start with the Emsella. Urinary incontinence isn't an issue for me, and actually ED isn't really an issue for me either. There is definitely a lot to be said about improved erections and improved intensity in orgasms. I don't need to get into how great that is, but I promise it's awesome. And the experience itself is super easy. There's nothing remotely uncomfortable about it. There is no pain. They really mean it when they say that. It's not unpleasant. It really is a fantastic little machine. I could go on for hours about how life-changing BioT has been for me. What I really want to focus on is the difference between BioT and other testosterone delivery methods that I've tried, because I've tried most of them. And the difference is stark. With previous methods, I've tried injections, I've tried creams, I've tried oral testosterone capsules, and they helped. I'm not going to say they didn't work, but they didn't work well. My testosterone levels, I was getting told, were in like the low to mid normal, and the doctors were like, yeah, that's okay. We don't have to do anything more than that. Low to mid normal is not enough. IoT focuses on getting your levels to optimal, and the difference is incredible. I felt like kind of okay on the previous treatments. I feel amazing on BioT.
What were you experiencing? What symptoms were you having?
You can check most of them off on that list. I was exhausted. I was walking around in a fog all the time, cognitive difficulties. I had trouble sleeping. I won't lie, there were some sexual difficulties. I had that middle of the afternoon nap issue. It was all there, all of it. And, those things faded somewhat on the other treatments. They're gone now, completely gone now. And I mean,
Pretty happy with it.
yeah. And I'm not doing weekly or biweekly injections. I mean, I go in for this twice a year.
So that's everything we've got for you tonight. I can tell you that I have personally experienced all of these things, and I'm not ashamed to say it, because whether they were medically or necessary or not, I was strongly encouraged by my wonderful wife to try everything that we have. And truthfully, for her, a big piece of it was just to get a man's perspective, because these are not things that are typically talked about by men. It's just not something that we do. And so she got me on everything to drag that out of me. And you guys heard some of that tonight. Speaking of that, thank you, Chris. Appreciate everything you shared, and just how candidly and supportively you speak and you have been. We absolutely love you for that. Thank you, Kirsten and Leslie, for joining us tonight and giving us really your expertise this evening. And thank you all for taking the time to spend this time with us and to learn with us about what we do. And for anybody who wants to further this conversation in some way, give us a call and we'll get you on the schedule. Consultations are one-on-one or occasionally two-on-one if Phil and I are both here and available. And one of the nice things that we offer as part of our consultation is a complimentary treatment on the Emsella, so you can experience at least that firsthand and get a better understanding of what it is that we do here. So we'd love to talk to you. Love for you to come see us. Thanks for joining us. Have a great night.
Thank you. Good night.